Hello and welcome to this video on anxiety for women who are pregnant or who have just recently had a baby. My name is Mandy Deeks and I'm a psychologist and I specialise in women's health, anxiety and depression, and I'm sitting with Professor Jane Fisher.
Hello.
Hello. Jane is Jean Hale's Professor of Women's Health at Monash and also has a long association with Masada's Mother and Baby Unit since it opened.
So it opened in 1996 and I've been the clinical psychologist there since that time, and therefore very closely involved in the development of their program, but also I've had opportunities to have conversations with thousands of women at this phase of life. And it's also a very close focus of my research interests. So a good understanding of the things that can influence women's well-being at this phase of life, I think is enormously important for women themselves, but also for their capacity to care well for their babies.
Absolutely. And I guess we're talking about two different times almost in a woman's life, because there are, my understanding is there are different experiences, different anxieties when you are pregnant, and then it's a whole new world when you have your baby. Yes, when your baby arrives. Can you tell us a little bit about the time when women are pregnant and the kinds of things that you see?
Absolutely. So we know that for every single pregnant woman, her background level of worry increases during pregnancy. And it seems to be increased in particular at the early part of pregnancy and again towards the end. And in the early part of pregnancy, it's often very focused on the health of her growing baby. And of course, her legitimate worries about, will my baby be okay? And what can I best do to protect the health of my baby? And new technologies which allow imaging of the baby have been called a double-edged sword, in that they can provide us with reassurance that everything seems to be proceeding well. But there's also potential for women to be given suggestions that perhaps there's something developmentally awry. But often they can't be told this in absolute terms, so they're given an estimated risk of problems with the baby, and that can be a very difficult thing to make sense of and really work out, well, does that risk really mean that there's something I have to do here in relation to the pregnancy? In general, that settles in mid-pregnancy, but towards the end of pregnancy there's often really significant preoccupation and concern about adaptation to life with a baby, what it will mean for her, for the things that she can't do when she's caring for a baby, about how she will actually manage this responsibility, and about the process of giving birth.
And it's certainly, I know from personal experience, you know, days just seem to take forever when you're pregnant because you're counting down, and so to have that level of anxiety for what seems like forever while you're waiting for your baby can be really difficult for some women.
Yeah. And I think managing anxiety at this phase of life is no different to managing at others. It's really important to have high quality information. So if the things you are worried about are things that you can learn more about, that usually is helpful. And it's also very important, as this is a time when women are in touch with healthcare professionals, to bring those worries to routine consultations. So that can be a conversation with a midwife, or with an ultrasonographer if you're having a scan, or with an obstetrician gynecologist, or if there is something of particular concern about your pregnancy, with the whole multidisciplinary team who's looking after you.
So it's really an opportunity, and it's important if you're feeling something, if you're worried or anxious about something, to ask.
Very important. Very
no question
important.
too silly.
Exactly. No question too silly. And also not to feel ashamed if you feel you need a lot of reassurance. So sometimes women feel, well, I'm asking the same thing over and over again. But that actually is just an indicator of how seriously they're taking this life phase. And it's a phase of life when, in general, especially having a first baby, Most women find they need a lot more reassurance than they've needed before. And they turn mostly to their partners and their own mothers at this life phase. And just because they need those people, it doesn't mean they're necessarily available. So if a woman doesn't have access to her own mother because of geography or because her mother is unavailable through being employed herself, or perhaps they don't even have a relationship that's warm and trusting, this can be especially difficult. And it's a time to acknowledge that that's a missing piece, and therefore to seek that kind of care from other people.
And what about when a woman has had the baby? What are the kinds of things that then you start to worry and be anxious about, and what can you do about that?
Well, I think one of the most beautiful phrases that I've ever heard, which I think it's very useful for women to reflect on, is that the birth of a baby is always the birth of a mother. I didn't say it myself, but somebody else wrote it. I think it's very useful.
It's lovely.
And what that means is you acknowledge that you don't know how to do these things automatically or intuitively. And this is a time, just as a baby has to learn a great deal, so too does the woman caring for the baby. And to really feel confident that this is a time when you have to seek all sorts of assistance from other people as you learn the skills of infant care. And in hospital, this is often the skills of learning how to feed your baby. But gradually, as the baby grows, you have to learn how to soothe and settle a baby, and this can be very anxiety arousing if it's not working well. It's also a time when you have to adjust to not having the social engagement that we normally have in our workplaces. So we have to begin to build new friendships and new relationships with other women in our neighbourhood who have little children. And I think there's enormous benefit in joining mothers groups or other activities that draw you into the company of women at the same life stage. The other thing that we know is really important is for women and men to develop a capacity to discuss quite frankly who does what after they have the baby, and that arguments about what women do and what men do are known to be bad for mental health. And in general, people underestimate how much the work increases in a household with a baby in it, and everyone has to do more in order for both of them to have some opportunity to enjoy this new life phase, to have some leisure and pleasure in the baby together. And that criticism is particularly harmful to well-being at this phase of life, and it's really important to avoid criticising each other's endeavours to learn to care well for the baby.
Thank you so much, Jane. There are some fabulous information and advice in what you've just said. I think, seeking knowledge, asking all the questions, communicating with everybody around you, but your partner in particular, and really, not being too frightened, I guess, to be able to have the conversation and talk about this is what I'm feeling and this is what I need right now. And connecting is such an important thing for us to do as human beings for our well-being. So making sure that you share the experience with other people. Thank you so much for your time today, and thank you very much for watching.